everyone. I'm Dr. Jamila Breck from Elevation Health Medical, and today I have with me Dr. Kristen. By the way, you guys probably don't know much about Dr. Kristen, but she has a PhD and has done a lot of research on the lungs and asthma. She even has published research, which by the way she will mention a little bit about today. But today the purpose of this video is to talk about the immune system. The reason we want to do that is because the governor of Texas reopened many businesses, and now people are going to go out of their homes, righteously so as well. And what does that mean for the immune system is this: it's going to be exposed to not only COVID, but the whole family of coronavirus. It's going to also be exposed to a lot of bacteria that the immune system has not been exposed to in your homes for the last 4, 5, or 6 weeks, however long you have been staying at home more often. So we want to discuss that a little bit more in detail today, and what does that mean for your immune system re-entering everything. So first of all, Dr. Kristen, what does that mean for people's immune system to actually go back out into the world as we know it now?
Yeah, so we've been staying in our houses. We've been probably sitting and watching TV a lot. So our immune systems going back in are going to be a little bit lazy because they haven't been exposed to the viruses they're normally exposed to, and they're normally used to fighting. So if you don't use something, you lose it. So
yeah, it's an unfortunate thing. So
right.
So as a result of that, what do you think is going to happen inevitably out in the world with all these people re-entering the world?
People are going to get sick.
Yeah. People will get sick.
Mm-hmm.
But the thing is, they're not going to get sick necessarily with COVID-19. They're just
Right.
going to get sick in general from other things, right?
Right, correct.
Okay. So now most people don't understand the immune system, so I want to make sure we discuss that today. So there's a few parts, obviously, to the immune system.
Right.
And what I have studied as a chiropractor and what you have studied as a medical provider is the immune system is controlled by the nervous system. There's two parts of the immune system, as I understand, as you medical providers understand as well. One being what I call the first barrier of the immune system. So what is that exactly, doctor?
That's the skin. So the skin is basically the wall around the fort that protects the viruses from getting in.
Okay, so our skin everywhere protects
Mm-hmm.
viruses and bacteria from
Right.
entering into the body.
Right.
What else besides the skin would be another first barrier of the immune system?
The mucous membrane. So any part that isn't covered by skin per se, so our eyes, our nose, our mouth, genitals, they're all mucous membranes. So if the skin isn't covering it, the mucous membranes are covering it.
Got it. So that's primary barrier, first
Yes.
barrier,
Correct.
protecting us from all those bacteria and viruses.
Mm-hmm.
So let's talk about gloves for a second, because I believe a lot of people have this false security with gloves, thinking that it protects them from bacteria and viruses. And of course, what we have seen out there, unfortunately, is people have gloves, they're touching everything, and then first thing you know, they are removing gloves with their mouth, or they're touching
Their eyes.
eyes. So what is the problem with this false security of gloves, doctor?
So the gloves will work if we use them correctly, and that would mean donning and undonning the gloves, or that means taking them on and putting them off. So putting them on before we touch something, and then taking them off before we're touching our eyes or our nose or our mouth. So essentially they work the same as the skin. So we have to use them correctly for them to work.
So to use correctly, then that would mean as soon as I touch something and I'm needing to touch any of the mucous membrane, I would have to remove those gloves first, wash my hands,
Wash your hands.
and then what? And then reapply gloves?
And then reapply gloves.
So
Yes.
technically, if we want to be secured with glove, I would have to do this motion of putting gloves on how many times a day?
The average person touches their face about 15 to 20 times an hour.
An
So,
hour.
An hour.
So
a lot of gloves.
that's a lot of gloves.
A lot of gloves.
Yeah, so I want to make sure that everyone understands this out there. Gloves are good, only if you use them properly after what we just talked about. So Dr. Kristen, thank you so much for your time today. And we're going to have another video here very, very shortly explain what is the second barrier in your body and how you need to deal with that.